Welcome to Intelligent Eye Care, your virtual consultant for your eye health needs. Today, we will discuss the potential complications of cataract surgery. Cataract surgery is a common outpatient procedure that is generally safe and has restored vision to millions of people. However, like all surgeries, cataract surgery has certain risks that you should be aware of prior to proceeding with the procedure. Today, we will go over the potential risks and complications that your cataract surgeon may not always have time to tell you during your visit. Understanding these risks empowers you to make informed decisions about your eye health for yourself. This content is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment. In this video, we'll explore the potential complications of cataract surgery, from common issues like floaters to more serious complications like retinal detachments. We'll cover it all. Let's dive in. A very real possible complication that we tell all patients is posterior capsular tear. If you imagine the cataract to be like an M&M, the goal of the cataract surgery is to remove the inner chocolate without damaging the posterior shell and then placing a new artificial lens into the shell. Sometimes during surgery, the delicate posterior capsular shell can tear or rupture, causing the cataract to fall backward into the vitreous cavity. If this occurs, then your cataract surgeon may not be able to completely take out the cataract on the same day. On another day, a retinal surgeon will need to take out the remaining cataract from the posterior cavity. Although uncommon, this occurs in 1 to 5% of surgeries according to published data. Despite this happening, most patients may still have a good outcome. Another unwanted complication from cataract surgery is floaters. Floaters are tiny gray or black specks and cobwebs that float around when you move your eyes. About 10 to 20% of patients complain of new floaters after cataract surgery. During cataract surgery, the vibration from the ultrasonic probe may cause the jelly-like substance in the back of the eye to shift and detach from the retina, causing a posterior vitreous detachment known as a PVD. Floaters from a PVD alone are harmless, but if you develop new floaters, a curtain covering your vision, or flashes of light after cataract surgery, you should tell your cataract surgeon so they can examine your eye to make sure there is no underlying retinal tear or retinal detachment. Retinal detachment may rarely occur after cataract surgery. The retina is a thin layer of tissue in the back of the eye, and a retinal detachment occurs when this layer separates from the underlying structures. It's a serious complication and it requires urgent laser or surgery. Retinal detachment occurs in 0.2 to 3% of cases. Corneal edema, or swelling of the clear tissue in the front of the eye, affects 0.5 to 2% of patients. It usually resolves within a few weeks after surgery, but severe cases may require treatment. Rarely, a corneal transplant may be required in the setting of severe corneal edema. Next, macular edema involves fluid accumulation in the retina, affecting 1 to 2% of patients. Macular edema causes blurry vision. Anti-inflammatory drops are usually used to manage this, but in serious cases, an injection into the back of the eye is given to decrease the swelling in the retina. Endophthalmitis is a severe infection in the eye that occurs in 0.05 to 0.1% of surgeries. This is a very serious eye condition and can lead to blindness if it is not treated promptly. Common symptoms of endophthalmitis include eye pain that keeps worsening, red eyes, white or yellow pus drainage from the eye, and/or decreased or lost vision. Posterior capsule opacification, or PCO, affects 20 to 30% of patients over 2 to 5 years after cataract surgery. A posterior capsular opacification is also known as a secondary cataract. If you develop a PCO, your vision will become blurry once again, but don't worry, your cataract surgeon would be able to perform a simple laser procedure to remove the scar tissue. This laser usually only takes a few minutes and does not require an incision in the eye. Dry eyes are common after cataract surgery due to corneal nerve disruption. During cataract surgery, the corneal nerves may be inadvertently cut since the nerves are clear. If this happens, then your eye is unable to sense that it is dry, so it does not produce enough tears to lubricate the eye, causing dry eyes. This can cause severe irritation and sensitivity. Artificial tears, lubricant gels, and other treatments can alleviate symptoms. Lastly, cataract surgery also increases the risk of developing glaucoma by 1 to 2% post-surgery. Discuss potential risks with your surgeon. Understand preoperative assessments and anesthesia options. Being informed helps you prepare for a smooth surgical experience. We've covered various risks associated with cataract surgery. From capsular rupture to dry eyes, each risk has its management strategies. Understanding these helps ensure a successful outcome. By being informed and proactive, you can navigate cataract surgery with confidence. Thank you for watching our video. Please subscribe to our channel, Intelligent Eye Care, for more information to protect your eye health.